Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, today we are going to talk about a life-threatening complication of an infection. Sepsis occurs when chemicals released in the bloodstream to fight an infection trigger inflammation throughout the body. Now, this can cause a cascade of changes that damage multiple organ systems, leading them to fail, sometimes even resulting in death. So, to discuss on this topic, we are being joined today by Dr. Jnandip Baishya, Senior Consultant, Nemcare Super Speciality Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for joining to Good Life, the health show today. And today the topic which we have taken might be a rare topic for the viewers who are watching our show at this point in time. It's sepsis. Now, what is sepsis? What would you like to tell our viewers if you want to share the information on sepsis?
Okay, namaskar. First of all, I would like to thank you all from the News Live team for giving me this opportunity to talk on this very serious topic of sepsis. Sepsis actually is the leading cause of death all over the world. One data from the 2017, it has showed that 11 million people died in that year only, 2017, from sepsis, and there were total 49 million of cases of sepsis. And most of these cases, more than 50%, were in children. And 2.9 million deaths were in age group of less than 5 years of age.
Okay.
And in India also, we see a very high rise in the cases of sepsis. And India is second highest in case of sepsis mortality in Southeast Asia, second to Afghanistan only. So sepsis is a very serious problem. It is a very important cause of death among population, and so this should be dealt with seriously. Now coming to the definition of sepsis, actually infection can occur to anybody,
Right.
but the sepsis is actually a very erratic response of our immune system to the infection. Everybody who gets an infection will not develop sepsis.
Okay.
Okay, so some people will develop sepsis, and that is a dysregulated host response, that is the response of the body immune system to the infection, and that causes a serious life-threatening event.
All right. Now, doctor, in general, if we say that sepsis is one kind of infection, if we want to understand our viewers who are watching our show, and we would like to tell our viewers that our numbers are flashed on your television screen. So if you have any queries regarding the topic which we are discussing at this point in time, so please call up and ask your questions. And Dr. Jnandip Baishya from Nemcare Super Speciality Hospital is with us. Yeah. And if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask your questions. Now, doctor, coming back to the topic, sepsis. Now, if we talk about the how important it is to raise awareness among the people regarding sepsis, how important it is.
Sorry, I couldn't hear you properly.
I was asking you that how important it is to raise awareness among the topic which we are discussing, that is sepsis. Why is it important to raise a public awareness about sepsis?
Yes. That's a good question actually. Sepsis is a silent killer.
Okay.
People actually do not recognize that a patient with an infection is developing sepsis, and so when they come to the hospital, it is already quite late. So when we start the treatment, patient has already lost a vital amount of time. In sepsis, time is the main factor which will determine the outcome. A patient coming to the hospital immediately or within a short span of time has a better probability of surviving than a patient coming late to us. So it is, and as I have already told you, that sepsis is the leading cause of death nowadays.
Okay.
every 5 deaths occurring in the world now,
Okay.
out of 5 deaths, 1 is due to sepsis. So it is the 20% of the all death. If I say in terms of percentage, then 20%, that means 20 people out of 100 people dying, they will die of sepsis. So this is a very major thing, and everybody knows about heart attack, everybody knows about stroke,
Right.
but people are very, very unaware about sepsis.
Absolutely.
Awareness about sepsis is very less. Yeah. So whenever there is a infection, a person is getting infected, he's having fever, or he's having cough, or he's having urinary infection, or he's having abdominal infection, having pain abdomen, then what people will do, they will just try to get some medicine from the nearby pharmacy. They will get some painkiller, they will get some medicine for fever, and they will also get some antibiotics, but
Right.
which is not the proper way of treating an
Okay.
infection.
All right,
Without
doctor.
knowing properly
Right.
what is the type of infection, what is the infection,
Right,
without the
right.
guidance of a doctor.
Absolutely. Doctor, we'll talk more on the topic, but right now we have a
Yeah.
caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello?
হেল্ল'
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় আপোনালোকৰ কভাৰেজটো চাই আছো
Hello.
এই বস্তুটো মানে কি কেনেকৈ হয় মানে চিম্পটমটো কেনেকুৱা কিবা অলপ ক'ব নেকি
Okay.
Actually, ইনফেকশ্যন যিকোনো ইনফেকশ্যন হ'ব পাৰে তেখেতে অসমীয়াতে সুধিছে কাৰণে মই অসমীয়াতে উত্তৰ দিছোঁ ইনফেকশ্যন এতিয়া যদি কাৰোবাৰ জ্বৰ কাহ লগা পানী লগা হৈ আছে বা কাৰোবাৰ পেচাবৰ জলনপৰণ হৈ আছে গতিকে তেওঁৰ চেপচিছত আছে নে নাই সেইটো কেনেকৈ গম পাব সেইটো গম পোৱাৰ উপায় হ'ল যে ঘৰতে আপুনি যদি চাব বিচাৰে তেতিয়াহ'লে পেচেণ্টজনে কেনেকৈ বিহেভ কৰি আছে তেখেত আগৰ নিচিনাকৈ নৰ্মেলকৈ কথা বতৰা পাতি আছেনে অকণমান বেছিকৈ টোপনি যোৱা আৰম্ভ কৰিছে বা অলপমান খেলি মেলিকৈ কথা বতৰা পাতি আছে তেখেতে ঘনাই উশাহ লৈ আছে নেকি আৰু ঘৰত যদি ব্লাড প্ৰেছাৰ মেচিন আছে তেতিয়াহ'লে তাত যদি চাব পাৰে তেতিয়াহ'লে তেখেতৰ বিপিটো কিমান আছে যদি বিপিটো 100কৈ তলত আছে ওপৰৰ বিপিটো যিটো চিষ্টলিক বিপি বুলি কয় ব্লাড প্ৰেছাৰ চিষ্টলিক ব্লাড প্ৰেছাৰ যদি 100ৰ তলত আছে তেখেতে যদি ঘনাই উশাহ লৈ আছে ৰেছপিৰেটৰীত যদি 22তকৈ বেছি লৈ আছে আৰু তেখেতে যদি অলপো ভ্ৰম বকিছে বা অলপ কথাখিনি অলপ খেলি মেলি কৰি আছে তেতিয়াহ'লে এইবিলাক হ'ল চেপচিছৰ চাইন গতিকে সেইকাৰণে তেনেকুৱা পেচেণ্টক ইমিডিয়েটলি হস্পিটেললৈ আনিব লাগে আৰু পৰাপক্ষত ভাল এখন হস্পিটেলত আনিব লাগে য'ত আপোনাৰ ICU ফেচিলিটিও থাকে কাৰণ চেপচিছৰ এবাৰ ডায়েগন'চিছ কৰাৰ পিছত প্ৰত্যেক মিনিট প্ৰত্যেক আৱাৰে কাউণ্ট কৰে ট্ৰিটমেণ্টৰ এভৰি 1 hour ডিলে অফ ট্ৰিটমেণ্ট কেন ইনক্ৰিজ দ্য মৰ্টেলিটি বাই 10%. এঘণ্টা দেৰি কৰি আহিলেও 10% মৃত্যুৰ হাৰটো বাঢ়ি যোৱাৰ চান্স থাকে গতিকে আৰ্জেণ্টলি পেচেণ্টক আনিব লাগে
All right. Thank you so much for calling. And doctor, we also have another caller at this point in time. Let's take the call. Hello?
হেল্ল' মই সুধিব বিচাৰিছিলোঁ যে মানে এইটো অসুখটো মানে কেতিয়া হয় কিমান বয়সত হয় সেইটো গম পালে ভাল
Hello? Hello?
Hello? Yeah, doctor, he was asking at what age do we see the signs of sepsis?
হয় কওকচোন কি কৈছে তেখেতে What? Sorry?
Hello? আপুনি যদি শুনা পাইছে আপোনাৰ প্ৰশ্নটো আৰু এবাৰ কৰিব
হয় মানে কি হয় মই সুধিব বিচাৰিছিলোঁ যে এই অসুখটো মানে আপোনাৰ কিমান বয়সত হয়
বয়সত আচ্ছা বয়সৰ তেনেকৈ কোনো সীমা নাই চেপচিছ যিকোনো বয়সতে হ'ব পাৰে কিন্তু 65 বছৰতকৈ অধিক যাৰ বয়স আৰু যাৰ বয়স এবছৰতকৈ কম তেওঁলোকৰ চেপচিছৰ চান্সটো বেছি হয় তাৰ বাহিৰেও আপুনি যদি সোধে যে আৰু কাৰ ৰিস্কটো বেছি চেপচিছ হোৱাৰ তেতিয়াহ'লে আগৰ পৰা বেমাৰ হৈ থকা পেচেণ্ট যেনেকৈ ডায়েবেটিছৰ পেচেণ্ট কেঞ্চাৰৰ পেচেণ্ট যাৰ HIV বা AIDS আছে তেনে পেচেণ্ট তাৰপিছত আপোনাৰ চিৰ'চিছ লিভাৰ চিৰ'চিছৰ পেচেণ্ট ক্ৰনিক লাং ডিজিজৰ পেচেণ্ট ক্ৰনিক কিডনি ডিজিজৰ পেচেণ্ট এইবিলাক পেচেণ্টৰ চেপচিছ হোৱাৰ আশংকাটো নৰ্মেল পেচেণ্টতকৈ বেছি হয় আৰু এনেকুৱা ক্ষেত্ৰত চেপচিছৰ হ'লে চেপচিছৰ চিভিয়াৰিটিটো বেছি হোৱাৰ চান্স থাকে গতিকে এনেধৰণৰ যদি পেচেণ্ট থাকে ঘৰত যাৰ বয়স 65 বছৰ বেছি বা যাৰ বয়স এবছৰতকৈ কম আৰু যাৰ এইবিলাক বেমাৰৰ ভিতৰত কিবা এটা বেমাৰ আছে তেনে লোকৰ ইনফেকশ্যন হোৱাৰ নিচিনা লাগিলে বা জ্বৰ কাহ আহিলে ইমিডিয়েটলি ডক্টৰৰ পৰামৰ্শ ল'ব লাগে, পাৰিলে হস্পিটেললৈ লৈ আহিব লাগে।
All right. Thank you so much for calling at this point in time. Doctor, we'll have more conversation on the topic, but we have to take a break at this point in time. Now, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Puja, and we are having a fruitful discussion on the topic, what is sepsis, with Dr. Jnandip Baishya. Well, Doctor, now coming back to you again, if we talk about the basic signs and symptoms of sepsis, how will an attendant understand that the person is suffering from sepsis and has to immediately go and consult a doctor?
Yeah. As I have answered already in the previous viewer's question, that whenever a patient is having fever or cough or urinary burning or pain abdomen, anything which is suggestive of infection, along with low blood pressure, you can measure the blood pressure at home if you have a machine. If you don't have a BP machine, then you can at least count the respiratory count. Okay, and then immediately if you find that the patient has a respiratory rate of more than 22,
Okay.
and a blood pressure of less than 100, or the patient is having an abnormal behavior, then you should immediately rush the patient to the nearby hospital. And already I have told that some patients, like the more than 65 years of age or less than 1 year of age, or patients with chronic diseases, diabetes, heart disease, lung disease, kidney disease, liver disease, they will be rushed to the hospital immediately if there is any signs of infection, if the patient is not well at home. We shouldn't wait till the patient is too sick that what we usually see that the patient is sick, ill since morning, but the patient relatives and patient, they expect that the patient will be all right by evening, by afternoon. They keeps on waiting, and then at midnight they bring the patient to the hospital.
But one
so
should not
already
wait.
12 hours of vital time has been lost.
Okay.
So it is always better to bring the patient immediately to the, one should not wait, that is the thing. And in case of infants, those less than 1 year of age, if the baby is taking his breastfeeding properly, or he is crying excessively or breathing very fast, then those patients should be immediately brought to the hospital.
Okay.
Instead of trying some home medication, they should be brought to the hospital immediately.
All right.
Or consulted, you should take consultation with a pediatrician over phone, and then if he advises, then you should bring the patient to the hospital.
Okay. Now, Doctor, if we talk about the role of intensivist as a specialist to treat sepsis, what is that?
Actually, sepsis is a very common disease, but it is very easily missed. Most of the intensivists are actually acquainted with dealing with sepsis in comparison to other specialties of the medicine, because the major admission, most of the patients that are admitted into an ICU are sepsis patients. More than 50% of the ICU admissions are sepsis patients. So we get to see so many of sepsis patients every day. So we can recognize sepsis very easily, very early.
Okay.
So the intensivists are at a better position to diagnose a patient of sepsis. Then again, sepsis calls for immediate action. Within 1 hour, we have to do some tasks. These are called bundle tasks. We have to do the blood culture, we have to do the ABG, we have to give IV fluids, we have to stabilize the BP. Within 1 hour, all these things has to be done.
Okay.
So those are those can be done in an ICU setup under the supervision of a intensivist, because we have to do things in a ward footage. So every hour of delay in starting appropriate antibiotic can increase the mortality by 10%, that I have already said. So it is important that the patient gets a proper ICU care whenever feasible. If there is no ICU facility in a hospital, then it's a different thing. But if the patient can be brought to an hospital with an ICU care, then it is always, there is a better chances of survival for the patient, because the global data I have told you, the most of the mortalities are from the low and middle income countries.
Okay.
Sepsis mortality is around 50% in low and middle income countries, in comparison to 15 to 20% only in developed countries. So if a patient goes to an ICU or if a patient develops sepsis in a developed country, then he has a probability of dying only 15%. But if the same patient is developing sepsis in a developing country or a poor country, then he has a 50% chances of dying. So it shows actually the need of an ICU care immediately in case of septic patients.
All right, so need of an
the
ICU
ICUs
care.
are made by the intensivists, so intensivists have a great role to play.
Right.
Yeah.
Now, Doctor, off late, we are
Yeah.
seeing that the increase in incidence of drug-resistant germs causing sepsis. So, we have been seeing this is being prolonged in the society. So, what is the reason behind this? Are people not aware properly about the infection, or what is the reason behind it? What, as specialists, what do you suggest to the attendants out there?
Actually, the thing is that most of the people, whenever they are having some infection like cough or cold, these are caused by viral infections or diarrhea. These are, most of the diarrheas are viral diarrheas only. So those things do not require antibiotic treatment. But what happens, the people, whenever they get a fever, they get some kind of loose motion, they get a cough, they have some abdominal discomfort, they go to the pharmacy, take some antibiotics. So what happens, those antibiotics, because of taking antibiotics repeatedly, our normal body has our normal gut flora, our own antibiotic flora.
Okay.
So those our own bacterial flora. So those bacteria are usually susceptible to all kind of antibiotics. That means all kind of antibiotics can be effective against them. But whenever patient takes antibiotics in every instance of cough, every instance of sore throat, then what happens? The bacteria become resistant to the antibiotics.
Okay.
So next time, whenever in reality he develops an infection due to a bacteria, then that antibiotic will not act. So that when he will take the antibiotic, he will not get the relief. Then patient has every probability of going into sepsis, because the antibiotic didn't work, because he has used the antibiotic previously without any indication. So this is a very, very serious complication, because whenever a patient comes from the community, that means from the house, his home, not from a hospital, or a patient who has never been to a hospital, who was never admitted in a hospital, those people when come to us, then when we do the cultures, urine cultures or the sputum cultures or the blood cultures, then those organisms which are cultured in those samples, they should be susceptible to all the antibiotics. But we find that many times those patients are also having multi-drug resistant bacteria. So the cause is that rampant use of antibiotics without any prescription from the doctor, taking the antibiotics over the counter from the pharmacist and taking it injudiciously. So that will ultimately harm the population. Yeah.
Okay. All right, Doctor, we are really short of time at this point in time. So what would you like to tell our viewers who are watching our show? And we have also heard about ICUs, patients being shifted to ICUs, and deaths are being occurred due to bacterial infections. So are bacterial infections and sepsis common, or what would you like to tell our viewers who are watching our show?
Actually, sepsis can occur due to infection from any kind of microorganism. That can be a bacteria, that can be a virus, that can be a parasite, or that can be a fungus. Most of the sepsis are due to bacterial and fungal infections. Almost 90% are caused by bacteria, 5% around is caused by fungi, and rest are caused by parasites and all, and and viruses also. So sepsis developing in a bacterial sepsis are actually the most common, and those are the patients most commonly we find in the ICU. And
Okay.
some patients develop sepsis after coming to the ICU also, because the patient came, suppose patient came to the hospital for some other reason. Patient came for surgery, patient came because of accident, patient came because of some other reason,
Okay.
and he had to stay in the hospital for quite long time. Then also in the hospital, the patient might acquire infections. So hospital acquired infections are usually, it has been seen, these are multi-drug resistant infections. But
Okay.
those patients coming from their home, they are having infections, they are having sepsis due to antibiotic sensitive bacteria usually.
All right.
Yes.
So all in all, we can say that a proper awareness to the public is very important at this point in time, isn't it? Thank you so much, Doctor, for joining to Good Life, the health show today, and giving those valuable information on the topic which we took today. Well, viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.